Welcome to Scrub In, a podcast powered by Bayhealth. I am your host, Sarah Beebe.
And I am your co-host, Tyler Cody.
Thank you for joining us as we ask ourselves to scrub in
and talk more about our why behind the healthcare uniform.
Welcome back to Season 4 of Scrub In, powered by Bayhealth, where we celebrate humans, heroes, and healthcare.
I cannot believe it's Season 4 already. Time really just flies when you're having fun.
I know. And welcome to 2025, Tyler.
Yes, bringing in the new year. It's going to be a good one.
Yes. Have you had a good new year so far?
I have, yeah. It's been a little busy after the holidays getting back to work, but everything's running smoothly and got a good outlook on 2025. So.
Awesome. You know, I just got back from a conference, a simulation conference, so I feel like we need to debrief 2024 a little bit.
Yes.
And in the conference, we talked about change, and that change tends to be a word that nobody likes.
Right.
But nobody changes for the worse. Mm-hmm. So everybody changes to improve.
Yes.
So let's say improve.
Yes.
So let's think about 2024 and the upcoming 2025. What do you think went well in 2024, and what do you think needs to improve in 2025?
Well, I think that 2024 was a year of a lot of changes. But I think that in terms of 2025, we just have to have a better outlook on our future and just make decisions with our best interests in mind. And yeah. Yeah,
2024 was rough for me as well.
Yeah.
But I think that as an organization, we did really well in 2024. Yeah. We're coming out of the height of the pandemic and really starting to get back to a new normal, I guess. Yeah. I hate to use that term. But and then 2025... we've got a lot of accreditations for our organization. So
yes.
I think looking towards all of that would be great.
Absolutely.
And how about you personally? Do you have any
personally, this year I'd like to buy a house, honestly.
Ooh,
so we've been
that'd be
saving
exciting.
Up for that. It's a rough time to do it, but I think that we've got a good plan in place. So more to come on that. We'll see how it goes.
Okay.
Yeah.
I'd probably like to focus a little bit more on self-care in 2025.
Yeah.
That's an area for improvement because 2024 I let it go and knocked it off a cliff, let it go. Yeah. So excited to get back to some of that kind of stuff. And we'd love to hear from our listeners as well. So if you have things that you'd like to change or, improve in 2025 and some things that went really well in 2024, just drop that in our comments and let us know what you're working towards this year.
Yes, let us know your goals and your aspirations for the new year.
Yeah, absolutely. Well, speaking of improvements and wellness, we have Dr. Thomas Vaughan here today. He is our Chief Wellness Officer here at Bayhealth. Welcome, Dr. Vaughan.
Thank you. It's a pleasure to be here.
Yeah. Well, we're excited to talk to you about what you do, what your why is, and also kind of some of the initiatives that you do. We do always start our episodes with a quote. So, Tyler, you want to give us the quote this week?
Absolutely. So our quote today: "The growth and development of people is the highest calling of leadership," spoken by Harvey Firestone, which reminds me I need new tires.
Oh, okay. That's also an expense this year.
That's my aspiration. Number one.
Well, so Dr. Vaughan, tell us about yourself.
Well, I was born and raised and grew up in upstate New York in a city called Binghamton, New York, which is right on the Pennsylvania-New York border, about halfway between Scranton, Pennsylvania, and Syracuse, New York. I was the youngest of 7 children. I have 5 older brothers and 1 lucky older sister. And grew up in a very neighborhood type environment there.
That's awesome.
I went to a small college in upstate New York called Hamilton College near Utica, and then I went to University of Rochester for medical school. So I was used to the cold that we're currently experiencing there.
Yes, you were.
Sounds very cold there.
And in medical school, I met my wife, who was a nurse, OB and ICU nurse. And I went to do surgery. I was going to be an orthopedic surgeon in Providence, Rhode Island. Went to Brown for a couple years of surgery before I decided that wasn't for me.
Okay.
Worked a year as an emergency room doctor in urgent care, and then went and did 4 years of radiology training in Bay State Medical Center, Bay State, and now it's Bayhealth, but Bay State's in Springfield, Massachusetts.
Okay.
And we came down to Delaware in 1992. We sort of picked it off a map.
All right.
They were transitioning the radiology department then. Dr. Martin Bagley was building a new department, hired 3 people just out of training, and we started what's the current, in 1992, is still the current radiology group at Bayhealth.
Wow.
That's awesome.
During
32 years.
32 years. During that time, I was 20 years president of the group and 15 years chairman of the department. And then a few years ago, I went part-time in radiology. I focused mostly on mammography and breast imaging, breast biopsies, and got very interested in wellness. So went part-time in radiology. I've been working as chief wellness officer at Bayhealth for the last several years.
That's wonderful.
Great.
And that's what, that's when I met you. And so I've gotten to see some of the stuff that you've done in wellness. Now, you mentioned you met your wife. You have a number of children and grandchildren. Is that right?
Yes. During residency, we had 3 children, so we moved
During
down here.
residency, you
What
had
a
3
time.
children.
When we moved in, 1992, our youngest was just 3 months old.
Wow.
And so we came down here with massive debt and 3 young children to start our family here. We thought we actually were just going to be here for a couple of years because it was a transitional group. It was a lot of uncertainty. And a while later, here we are.
Yeah. With children and grandchildren and roots down in Delaware.
Yeah.
So tell us, what do you do in your wellness role?
So we started the wellness, it was about 7 or 8 years ago. The hospital, in radiology, we had good patient experience scores. And they were saying, look, can we transmit that to the rest of the medical staff and that? So we went to some conferences. The Studer group back then was working with a lot of the wellness. And we got a group of about 15 doctors from all the different specialties together to talk about what we could do for the patient experience. And within 20 minutes, we came to the realization that it was really the burnout and things that were affecting things the most. So we pivoted and have worked with the medical staff on that for the past 6 or 7 years on wellness. Some of those initiatives sort of expanded to the whole healthcare system. And for the past 2 years, that sort of has dwarfed into what is now called the Be Well Committee, which is people from all across the organization, nursing, patient safety, volunteer group, who get together and have formed a group with initiatives aimed at helping all the Bayhealth team members.
Yeah.
Great.
There's definitely that Be Well group, and some of your initiatives are really starting to expand. You can feel them throughout the organization.
Oh, absolutely.
There's always something new and more so than just self-care and take care of yourself, which can be triggering coming out of the pandemic. It does feel like there's a real focus on wellness overall across the whole organization, which is awesome.
That's great to hear. The burnout in healthcare system is widespread.
Yes.
It's physicians, what we started with, have some very unique challenges and really unsustainable expectations
Absolutely.
of perfection.
Yeah.
And all that also translates to basically everyone who works in Bayhealth.
Right.
But it's not that the people aren't resilient. It's that the system, the medical culture, the expectation for perfection, the uncompromising demands, the fact that you're making hundreds, thousands of decisions every day that can be fatal to someone.
Absolutely.
Brings challenges that most professions don't have.
Absolutely.
But it's more of a system. So our work is really, what can we do for the system to make things more efficient, to make things easier, to decrease the number of errors. But while you're fixing the system, you still have to worry about yourself too. People, healthcare workers, physicians, APCs, nurses, they all come in with higher resilience than the average person, but they sort of get beaten down. So while we try to fix the system, it's important to do self-care things as well.
Yeah, absolutely. So what are some of the initiatives that you have put in place for that, to support those clinicians while the system is also working?
We have a couple things. One thing is a reward and recognition system for both the physicians and the entire Bayhealth team, where we give, where people are nominated through Baynet, and we give out one called the Above and Beyond Award.
Oh,
Yes.
yeah.
We've given out a
Seen
couple
several of
hundred of
those.
those. You get a $50 gift card from Amazon and other things, but most important, you get the recognition. The marketing does a nice job. They put them on Facebook, and people feel much appreciated. We see people might have 50 or 60 comments on those.
Yeah.
Right.
The physicians and advanced practice clinicians have something called the Credo Award, which is a physician credo. They get nominated by peers, patients, staff. Again, everyone wants to feel rewarded, and that will help enhance your professional fulfillment. So that's one side of things. To work on the system, we have something called a Get Rid of Stupid Stuff. It's popular among healthcare systems. It's called GROSS, Get Rid of Stupid Stuff. And people come up with ideas and to make their lives easier.
Okay.
Things they might have to duplicate instead of doing, or things that someone else can do to make their jobs easier, to make them less unsustainable. So that's an important thing. A foundational part of any wellness, which we've expanded now to the entire healthcare system, is our peer support system.
Yeah.
And that's really the first big initiative from our Be Well committee. The committee was first called the Interprofessional Wellness Council, or something that was sort of boring, so we changed it to the Be Well committee. And we wanted to start with something foundational like peer support, where if you have stresses, if your job is, you're having trouble with your job or troubles at home, you can call someone, and we would have trained team members from Bayhealth reach out to you.
Great.
Listen to what you have to say, help you through things, maybe offer some resources.
Yeah.
We were really fortunate to get a federal grant that turned out to be worth about $100,000 that partnered us with the Johns Hopkins RISE program, which is considered to be probably the premier peer support program in the nation. RISE stands for Resilience in Stressful Events. And over the past year, we've had the Hopkins team has come over and trained, which we had 150 people from Bayhealth offer to be trained so they can reach out to their colleagues and help out. The Hopkins team has done that for over 150 healthcare systems in the country.
Oh, wow.
And they've never had a response like they've had at Bayhealth. They told us we can get 10 or 15 people, that would be good.
Yeah.
So it's been something we just started. We've had about 10 or 12 activations so far where people would reach out and we send people to see them. So it's in its infancy, but it's been a really successful thing. And I think an important thing to send people the message that we understand this is a very stressful, uniquely stressful type environment, and you see things that most people never even experience or see, much less on a daily basis.
Yeah.
And offers that.
I took that training, and I'm one of those peer support folks, and I echo what you said with the Johns Hopkins folks. They did make a big fuss over the fact that not only did we have one training that was really large, but we had two that they had never seen that many people in a room signing up for RISE, which was pretty cool. But one thing that I really liked that they said was that, it's really important to talk through some of your feelings early on after you have a stressful event. So, maybe you have the loss of a patient, or you have a medical error or something that you're carrying around with you. And they talked about how the longer you carry that with you, the physical and emotional symptoms that go along with that, and just kind of talking to someone early on, and you don't even have to solve any problems, just to kind of talk through it can really make a difference in preventing some of those physical and emotional symptoms that come along with kind of carrying that burden. And it was a wonderful training.
Very interesting. In the old physician expectation where the people would just keep all these things inside.
Absolutely.
And since a lot of this has come out, Dr. Albert Wu, who leads it from Hopkins, wrote the initial article, which he calls Second Victim, which is there's the person who is suffering and with their illness or with whatever happened, but then all the people taking care of them, very empathetic people, also suffer from things that happen often that don't turn out great.
Yeah.
And he talked about a number of physicians and nurses who have had over the years the expectation was never to tell people about this stuff, and they don't sleep at night, and they have these deep-seated internal things because they've never let it out. And some of them now are going out and knowing the scars that they had and areas that they've walled off over time.
Can lead to like a long-term effect of anxiety and just things that you really, you keep with you for a long period of time.
Oh yeah,
And
absolutely.
burnout from
Absolutely. And in the sim world and in patient safety, we talk a lot about transparency and talking about things, hospitals and also our professions, both nursing and physicians, and really any healthcare profession. The old belief was you kept it all in because you didn't want to get in trouble.
Right, exactly.
You didn't want to seem
Confidentiality.
weak. There was confidentiality. And now we really are trying to break that culture so that we have a just culture, so that it's a safe place to be transparent about mistakes that might have happened or things that you're uncomfortable with or when you are having a bad day, and trying to create a culture where it's okay to mention those things without being penalized or punished or made to look inferior in some way. And I think we probably still have a really long way to go, but this program, simulating different activities, certainly help to create that culture.
Remove the stigma from a lot of that. One of the things we did with the medical staff and the physicians is with the credentialing.
Okay.
Because people were, many physicians would be scared to see a psychiatrist, go to any mental health, because
Absolutely.
you have to report it and potentially lose your license.
Wow.
So we've made changes, both we worked with Christiana and the state to decrease some of the demands that you have to report every problem that you've had in your life, to focus on current limitations that people might have or anything that would only currently affect you,
Right.
and to allow people to get the help they might need or seek
Right.
out.
Well, and someone who's going through something difficult, if they are seeking help and maybe they're on medication, they're actively doing things about it, they can continue to function. I mean, that's the point
Exactly,
of
yeah.
medication, therapy, exercise, all of those things. And so really, what's the incentive for improving if you think that you're going to get penalized in some way by your accrediting board or your, by your colleagues? And so, just like, we have diabetic physicians, they take care of their diabetes and they come to work and they're able to function, so.
But that's a newer thought on things, because it wasn't
Absolutely.
in the past. We worked pretty closely with the Dr. Lorna Breen Foundation. She was
Okay.
an emergency room physician who died by suicide in New York over COVID.
Yep.
And one of the things that she was worried about was to seek help, because she was worried she'd lose her license.
Right.
And her family has taken that on, developed a lot of this, and helped us change. We completely rewrote our credentialing, and that was passed unanimously by all the groups in the hospital to do
Wonderful.
that.
Fantastic.
That's wonderful. Well, moving to a lighter note, what are some of the other activities that you are passionate about in the community and with your wellness
Right.
projects?
What fills your bucket?
Well, one of the things that are community efforts, and interestingly, to fill people's bucket or to enhance their resiliency, or only a few things have been proven. Sort of exercise or things that you're very passionate about, important to have those in your life.
Yeah.
Mindfulness and meditation and yoga type things, those have also been proven to really help people enhance their professional fulfillment. And that coaching for healthcare workers, whatever, also one of the few things that help. But another thing that you wouldn't think of quite a bit is volunteering and giving
Yeah,
back.
absolutely.
And it's sort of ironic that taking your time and doing other things actually helps with yourself and with your own things. And the big effort that we've undertaken is something called Free Bikes for Kids.
Yeah.
Delaware. I started that a couple of years ago with impossible to do it without all the support from the administration at Bayhealth. And it's a community, it's a nonprofit that basically it's very simple. We collect bikes and fix them up and then give them out to kids in need.
Awesome.
Kids are identified through schools, churches, federal agencies, different other nonprofits, Boys Clubs, Girls Club, Salvation Army, places like that. We've been in work for about 2 years, and the mission is threefold. There's kids get a lot out of having a bike.
Oh, yeah.
For their health-wise, for their expanding their knowledge of what's around them. Everyone remembers their first bike.
Yeah.
Oh, absolutely.
But also to bring a community together to work on doing that. And with all the conflicts around today, when people come together and work on bikes from all areas, and you don't know if they're this or that, or people who may not get along otherwise, work together for that. And for the environment, we keep the national group has donated over 200,000 bikes to kids over the last 8 years.
Wow.
And they've kept thousands of tons of metal out of landfills. All the things that comes with a bike, plastics, cardboard, whatever, is all recycled.
That's awesome.
And we've been able in the last 2 years to give about 525 bikes out to kids in Kent and Sussex
That is
counties.
so fantastic.
Wow, I didn't realize it was quite that high. That's wonderful.
Yeah.
There's nothing like having a bike when you're a kid. It's like one of the best, fondest memories I've ever had.
It's interesting when people have donated our bikes to us. Almost everybody comes with a story about the bike. And this was my son's bike, or this was this, and this bike did this, and people are really happy to see that. So that's been a really fulfilling thing we've done.
That's wonderful. Having a bike not only is a form of exercise, but it also gives kids kind of their first sense of independence.
Oh,
Because they get to ride their bike maybe away from their parents or around the neighborhood or something like that, which is wonderful.
It's like an element of exploration.
Yeah.
Right. To see the kids get the bike, it's just really an incredible thing.
That's wonderful. Now, one thing that we ask everybody on this show is, what is your why? Why do you do what you do? So what's your inspiration?
It's a good question. I think similar to many people, that sort of have a framework of that is I always was interested in working as a team with others to find things that are meaningful and have purpose. I think it's a lot of people have that. I think over time your why changes.
Yep.
When you're out initially. When I was in college, I'm not one of the people who knew what they wanted to do their whole life. I was I was planning on being a math teacher and a basketball coach until I was about a junior in college. In our neighborhood where we grew up was not a doctor neighborhood. I don't think anyone had gone to medical school out of the high school except for my two older brothers.
Okay.
One was a heart surgeon. He was already in practice. Another was in training as a cardiologist. And I was more of a sort of why not? Might as well give it a try. I saw them doing it, and if they could do it, I could certainly do it.
Sure.
And it was sort of to prove yourself and to find something that you might have skills in and could do. And that's early on, that becomes your why.
Yeah.
As you then get out into practice, it's establishing yourself in practice. You might have a family, you have to have a job to do that, and figuring out schools and houses and things like that. Right. And as you go on, I think you find more that what do you have real interest and passion in. And if you can add passion to the meaning and purpose, I think that's really the secret key to a lot of this.
Yeah.
And so the wellness, a lot of the wellness is, I see a lot of things in medicine going these days that weren't like they were before. Many better, some worse. Some of the best parts of it, though, have been lost with shift work and having to wait 6 months to get an appointment somewhere. And I think a lot of the wellness can sort of try to give back some of that to the newer people coming through. That's
wonderful. Well, we are getting close to the end of our time. Is there anything else that you wanted to share with our community that listens? I think important for the Bayhealth team members, our RISE program is in the next month. We'll be handing out badges to everyone. They'll be sending out in the mass distribution, which in these days with the internet and all that, we don't do mass distributions like we used to. No,
Used to be they'd be sending stuff out, so that's been a little tricky. But we have badges for each person, and there's a QR code on it.
Okay.
And you just do the QR code with your phone and just put your name in and your phone number, and someone will contact you if you're having any type of stresses, you even just need to talk to anyone. These programs usually develop slowly. Christiana Care actually has one of the top in the country. They started 7 or 8 years ago, and they started 30 or 40 in the first year, and now they actually get about 50 people a month ask, and they meet with their colleagues and discuss things and get referrals for things. So as people learn about this, anyone who has stresses or just needs to reach out, I really want to encourage people to do that. And if they happen to have a bike to donate,
sure,
that's what I was going to suggest. Yeah,
they can bring that along.
IT department and the Blue Hen Corporate Center has been great partners with us. Our Bayhealth gave us a workspace over at Blue Hen.
Okay.
And anybody can drop bikes off to Jane Paradise in the IT department, and they'll get them to our thing, and we'll get them off to a kid.
Wonderful. Perfect. Well, thank you so much for joining us. This was a great conversation, and I appreciate you being with us.
Oh, great.
Yeah,
Thanks.
Thank you very much, Dr. Vaughan.
Very impressive. You guys have really started something. It's hard to start something new. In healthcare, a lot of people have ideas on how to fix things, which you hear all day, every day. But not many people actually start something that's a worthwhile thing, and much less been as successful. So hats off to you guys.
Well, thank you so much. And we like to thank all of our listeners. Keep in mind that we would love for you to subscribe on Apple Podcasts, Google Play, Spotify, YouTube, or just go to bayhealth.org/scrub-in.
Right, and leave a review and make a comment about what your goals are for 2025. What are you looking forward to the most?
Absolutely. Thank you.
Thank you.
Thanks for joining us on Scrub In, a podcast on humans, heroes, and healthcare. If you enjoyed this episode, be sure to subscribe and follow us wherever you listen so you don't miss what's next.
Please leave us a review, tell a friend, and come scrubbing with us next time.